Hello everybody, this is Dr. Omid, and in this video I'm going to talk about the urinary system. I hope this video it will be useful for you. Thank you. In this video we are going to talk about the urinary system. The function and the purpose of the urinary system is to eliminate the unwanted material from the body, and in this case the regulation of the blood volume and blood pressure by producing the hormone. Also they are controlling the levels of the electrolytes and metabolites, and in this case they are regulating the blood pH. The main function of the kidney, which is the main organ of the urinary tract, is production of the urine. And also the kidney is playing a role for the production of some hormone like renin and erythropoietin. Renin to regulate the blood pressure, and erythropoietin for the formation of the red blood cell, affecting on bone marrow. And also it's producing the derivative of the vitamin D3. So the kidney is located, is the main organ, of course, as we said. We are going into details of each structure. It's a bean shape and is located retroperitoneally. This is covered by the capsule that is highlighted here, the right side and the left side here. And inside this fibrous capsule, we are going also to discuss about the layers of the covering of the kidney. This capsule is very easy, can be removed from the surface of the kidney. So after the kidney, the urine which is produced, it's going to the renal major and minor renal calyxes that we are going to discuss also. And here is for the right side and here is for the left side. Then this calyxes, and finally it's lead to this part of the urinary tract, which is called renal pelvis. This is the right renal pelvis and this is the left renal pelvis. And finally from the renal pelvis, which is coming out of the kidney through this area which is called hilus, then it's followed by the left ureter and the right ureter. This ureter also, the passage in the abdominal part, it's retroperitoneally passed, then it's entering to the lesser pelvis, and then it's, as you see, it's entering to the urinary bladder from the posteriorly and from the side way it goes, and it opens to the two orifices to the urinary bladder. And the urinary bladder, of course, the function is to storage of the urine, and here it's highlighted. And after the storage of the urine, so the urine is transmitted to the urethra. This is the female urethra. It's very simplified. It's approximately 3 to 4 centimeter. In male urethra, it's a little bit complicated because it's the passage of the urine is mixing with the passage of the sperm and ejaculatory fluid, and in this case we have much more complicated. So this is the general structure about what you said, the urinary tract. So once more, here is the highlighted of the kidney with the capsule. And then you have the renal pelvis here, then you have the renal ureter or ureter just, and then finally it's highlighted as a urinary bladder, and here is the ureter. So this is macroscopical anatomy of the kidney, the part of this kidney. So you are looking at the right kidney. Each kidney has two surfaces, the anterior surface that you are watching it. So anterior surface is highly convex, and the posterior surface, if I turn it, so it's somehow almost flat, as you see here. Then each kidney has two extremitas or two poles. One extremitas is superior extremitas or superior pole, and the other one is the inferior extremitas or inferior pole of the kidney. Then the margin, so each kidney has two margins. This margin which is directed laterally, it's convex also, is called lateral margin, and this margin which is directed medially is called medial margin. At the midpoint of the or middle of the medial margin, you can see the place for the entrance of the and exit of the vessels and renal pelvis, which is called hilus or hilum of the kidney, and the pronounced place at the medial border or medial margin of the kidney is called also the sinus, the renal sinus. So this is the macroscopical view of the kidney. As you see, the size, the normal size of the kidney, the inferior superior direction is approximately 10 till 12 centimeter. The width of the kidney is approximately 5 till 6 centimeter, and the diameter of the kidney approximately is 3.5 till 4 centimeter in normal adult. The weight of the kidney is approximately between the 120 to 170 gram, and in the case of the losing of one kidney, the other kidney can be enlarged as a hypertrophy of the kidney or compensative hypertrophy of the kidney, which can be enlarged 2 times more than the normal size. So here we have the macroscopical view of the kidney. As we said, that the kidney is the retroperitoneal organ, and the diameter and the dimension of the kidney, the supero-inferior direction or craniocaudal dimension is approximately 10 till 12 centimeter. From the lateral side to the medial side, it's approximately 5 till 6 centimeter. The thickness of the kidney is approximately 3.5 till 4 centimeter in normal condition. Of course, we said that, for example, by losing of one kidney, this dimension or diameter, it will be increasing 2 times almost. Then we have two surfaces on the kidney. One surface is anterior surface, which is convex, and the other surface is posterior surface, which is flat almost. Then the kidney has two extremitas or two poles that they are not that much sharp or blunt. This is the superior pole or superior extremitas, and here is the inferior pole or inferior extremitas that they are blunt, they are not that much sharp. Then it has two margins. One margin which is located laterally, it's the lateral margin and it's convex, and the other part, it's the medial margin. At the medial margin, we have the place for the entrance and exit of the vessels and the ureter, and as we mentioned it before, this structure, they are passing through this place which are called hilus or hilum of the kidney, or renal hilus or renal hilum of the kidney. So, and the place, the prominence place for the hilum is called the renal sinus. So, at the hilum of the kidney, you can see the most anterior structure is renal vein. As you see, is very thin layer of the tunica media or the muscular wall. You can recognize it, that is vein. Then under that it must be, or posterior to that, it must be the ramus anterior, or the anterior branch of the renal artery, that it pass in front of the renal pelvis, or they call it peripelvic artery. And then if I turn it to the posterior side, you can see then you have the renal pelvis that is coming out from the hilus and is continue as a ureter. And behind that, the most posterior structure is the posterior branch, or ramus posterior, or retropelvis pelvic part of the renal artery, that is cut. So here four structure from anterior to the posterior renal vein, anterior branch of the renal artery, the renal pelvis that is followed by the ureter, and then the posterior branch or retropelvic branch of the renal artery. In this preparation, I would like to show you the fibrous capsule of the kidney, that it's attached to the surface of the kidney in the normal alive person. The color is the reddish and brownish color. Here, by the effect of formalin and alcohol, the color is a little bit pale. So here you can see the fibrous capsule that after cutting you can easily remove it from the surface of the kidney, and it's followed by the adipose capsule or fatty capsule. Here is again the superior extremity, inferior extremity. This is the lateral, and this is the medial margin. This is the hilus, that the vessels and the renal pelvis and ureter is exit from the hilus or hilum of the kidney or renal hilus. So here is the right kidney. The previous preparation that I show it to you also is right. So here is another preparation. You can see the fibrous capsule. As you see, if I remove it, so you can see very easily it's removed from the surface of the kidney. So like this. And also this fat tissue that you can see, those are the remnant of the adipose capsule or fatty capsule that is covering over the fibrous capsule. So here is the fibrous capsule. You see, very nice. It can be removed from the surface, and here there are the remnant of the adipose capsule after the dissection. Regarding the blood supply of the kidney, here as you see, you can see the kidney in situ. Here in the right side you can see the pathway of the vena cava inferior. As you see, here you can see the pathway of the left renal vein, and here is the pathway of the right renal vein. The left renal vein is much more longer than the left one, because inferior vena cava is located in the right side. And then here you can see the descending aorta, respectively, is abdominal aorta that is sending the renal artery. So I am trying to defining the highlight of this structure. So if this is the inferior vena cava, and here I will color it by the blue as a left renal vein, and here is the right renal vein. So here you can see the position of the renal vein at the hilus of the kidney. So at the hilus of the kidney, the most superficial structure that you can find is the renal vein. And then if I remove this renal vein and I go to the abdominal aorta, I will color it by the red color. So here, and then I mark it as a renal artery, the left one, and you can see the renal artery. Here is the renal pelvis that I will color it by yellow here. Here is the left renal pelvis, I'll color it by yellow. And here is the ureter, I color it by another yellow color, this to recognize. And here is another urethra. This is the ureteric artery that is arising from the renal artery. So here you can see the structure that they are passing through this is the renal artery. Also, I will color it by the red color here, that it will be recognized. So here it's the kidney that is covered by the capsule. Here is another kidney covered by the capsule, and here is the renal vein. So if I remove the renal vein, what will happen? You will see. So immediately under the renal vein, you can see that the renal artery is passing. Renal artery is coming from the abdominal aorta at the level of L1. Approximately vice versa, the left renal artery is shorter than the right one, because the aorta abdominalis or abdominal aorta is located on the left side. Is vice versa. And here you can see the passage of the renal artery toward the hilus, and you see that it's immediately behind the renal veins. Renal artery, when it's going to the hilus, then it's divided to the two parts. One part that is going behind, as we mentioned it here, it was renal pelvis, and one branch of the renal artery goes under or posterior to that. It's called the posterior branch or posterior ramus of the renal artery, and the other is going above or superficial to that or anterior to that. They call it the anterior branch of the renal artery. So the posterior branch sometimes is called the retropelvic, and anterior branch is called peripelvic. Here I will try to also remove the renal vein to see here the renal artery, and I remove the vena cava also. Then you can see this is the renal artery, the right renal artery, and here is the anterior branch, and under that is the posterior branch, and between the anterior branch and posterior branch, or peripelvic branch and retropelvic branch, is passing this yellow color that I mentioned it. Then it was determining the renal pelvis, so it's passing between these two. So if I say the structure of that they are passing on the hilus of the kidney, the most superficial structure or anterior structure is the renal vein. Then is anterior branch of the renal artery, then is renal pelvis, and then there is posterior branch of the renal artery. So those four structures, you can see it by the cross section, and very nice. You can see in this area. So once more here, if I remove the renal artery, you can see that the renal pelvis, maybe here is better. If I remove the renal artery, but between anterior and posterior branches arising the renal pelvis. So here, after the renal pelvis, after it's coming out between the anterior and posterior branch, or peripelvic and retropelvic branch, it's continue as a ureter downward. So this is the relationship of the structure that you can find it in the hilus of the kidney. So here you have the inferior vena cava, the left renal vein longer, the right renal vein shorter, and I am going to remove this renal vein, and you can see behind the renal vein what the structure is passing. So here you can see slowly the renal vein is removed, and you can see the artery. So after the removing, once more, if you look at it, so to understand that really the renal vein is the most superficial structure or anterior structure at the hilus of the kidney, and I am removing the renal vein, and then is renal artery, which is at the hilus of the kidney. It's divided into the anterior branch and posterior branch, and between them it passes the renal pelvis. So I'm going to see what will happen when the anterior branch and the posterior branch are entering to the kidney. So if I go to the deeper cross section, you can see that the anterior branch of the, or peripelvic branch of the renal artery then is divided to the four segmental artery. The four segmental artery for anterior branch is the superior, the anterior superior, the anterior inferior, and inferior segmental artery. And the posterior branch that is here, and we will see if we go to the deeper section. So you see that posterior segment here, it's just giving one branch which is called posterior segmental artery. So in this case, according to the division of this segmental artery, we have 5 segments in the kidney, and 4 of them it's according to the division of the anterior branch of the renal artery, and 1 of them is according to the posterior branch of the renal artery. So the anterior branch is giving the anterior, the superior, anterior superior, and anterior inferior and inferior, and the posterior branch is giving the posterior segmental artery, and the name of the segment of the artery is the same as the branches of the artery. So I'm going slowly back to see from deeper structure to the superficial structure. Here is the renal vein. Those are the relationship of the renal vein with the other structure that we are going to discuss before. So So here there are the blood supply of the kidney and the vessels of the kidney. For your orientation, here is then the right side, here is the vena cava inferior, and here is the abdominal aorta. Here is the right kidney, here is the left kidney, superior pole, inferior pole, lateral margin, anterior surface, and the hilus or renal hilus, and the same here. As we said that the renal vein, which is here, it's coming from or exiting from the hilus of the kidney, and after a passage to the retroperitoneal space, so it reach and it drain to the inferior vena cava. The same you have it in the right side, and you have it in the left side. As you see, the left renal vein is longer than here you have the right renal vein, which is the right renal vein is shorter because vena cava inferior is on the right side more. And then you have the abdominal aorta, and we said that abdominal aorta at the level of approximately L1, it's giving the branch to the renal hilus. It's called the renal artery. That at the hilus of the kidney, it's divided into the anterior and posterior branch, or peri and retropelvic branch here. And vice versa, the left renal artery is shorter than the right renal artery. Be careful in kidney and blood supply of the kidney. Almost in 30% of the population you can see the accessory renal vein as well. This accessory renal vein, either it can come from the abdominal aorta or it can come from the renal artery. They are variable, and you can see here this right kidney, it has two blood supply, the arterial blood supply. This one is one that is going to the hilus, and this one is going, the second one, and going to the hilus. This accessory renal artery, it can be to the superior pole, it can be to the inferior pole, it can go to the hilus. Clinically important if it's close relation with the ureter, so sometimes it can press and compress the ureter and make the obstruction of the ureter in this case. So this is clinically important, and in 30% of the population we have it. Since I have this abdominal aorta almost a little bit above the exit of the renal artery, which is here, and here, as we mentioned it here, we have the superior mesenteric artery. This artery that is cutted, it's the superior mesenteric artery, which is unpaired branch of the abdominal aorta, and above that it was the celiac trunk. Then the renal artery here, it's coming, and then down a little bit here and here they are the artery, testicular artery or ovarian artery, depending on if it is male or female, or gonadal artery. It's arising from the abdominal, and they are paired. And finally here, this artery is the inferior mesenteric artery, another unpaired branch of the abdominal aorta. And here is interesting that here is the renal vein, the left side, and to the left renal vein usually is drained the testicular or ovarian vein to the renal vein, and also here is the suprarenal gland or adrenal gland, and also the suprarenal vein also on the left side. In the left side is draining to the renal vein. But on the right side, the testicular or ovarian and the suprarenal, that we don't have it here, it's directly, usually it's draining to the inferior vena cava. This is the usual and normal drainage of the venous drainage in this area. So all this structure that you see, they are located retroperitoneally, and in the retroperitoneal space, it means behind the peritoneal cavity. Here there are the blood supply of the kidney and also the other large vessels of the aorta. Very nice preparation that you can see the ascending aorta, which is cutted, and here is starting the arch of aorta. Arch of aorta, as you know already, it gives the brachiocephalic trunk. Then this brachiocephalic trunk then is divided to the right subclavian and the right common carotid artery, and to the left side we have directly the common carotid artery, the left one, and the subclavian artery, the left one, is coming from arch of aorta. Then arch of aorta approximately at the level of T3, T4, Then is continue as a descending aorta, which is the first part is the thoracic aorta, it running through the posterior mediastinum. From the superior mediastinum goes to the posterior mediastinum, and then is passing through the diaphragm, through the aortic hiatus, together with the thoracic duct. Also, it passing through the aortic hiatus, and is starting as the abdominal aorta. So here you have the abdominal aorta, and the first unpaired branch of the abdominal aorta, which is a large vessel here, is the celiac trunk. This is the celiac trunk, which is giving this splenic artery or lienalis artery for the spleen. This is the left gastric artery, and this is the proper this is the common hepatic artery. The common hepatic artery, then it's subdivided to the gastroduodenal artery and the proper hepatic artery, which is then it divided to the hepatic artery, and this gastroduodenal artery, it's sending the right gastroomental or gastroepiploic artery and the superior pancreaticoduodenal artery that is divided to the anterior and posterior part. Then this is almost at the level of T12. Then at the level of L1, approximately another unpaired branch of the abdominal aorta is this one, which is the superior mesenteric artery. It's directed toward the right side, and it's giving several branches for the pancreas and duodenum, like a pancreaticoduodenalis inferior. Then is divided to the anterior and posterior. Also, it gives the jejunal and ileal branch for the small intestine. Also, it gives the ileocecal or ileocolic artery, which is then toward the appendix. It gives the appendicular branches, and of course it gives for the ascending colon right colic artery, and for the transverse colon it gives the left colic artery. So those are the artery for the blood supply of the small intestine that we mentioned it already in gastrointestinal tract, that they are making the arcades and they have the straight arteries. And a little bit short below the exit of the superior mesenteric artery, then you can see the left renal artery and right renal artery. We said right is longer than the left side because aorta is located more in the on the left side, and here it's missing the testicular or ovarian artery, but dorsally a little bit. So abdominal aorta, it gives the four parietal branches, which are the lumbar artery, and then here approximately at the level of the L3, so it is giving another unpaired branch which is going toward the left side, which is the inferior mesenteric artery, which is supplying descending colon like a left colic artery, sigmoid colon like a sigmoid artery, and the superior part of the rectum, which is called superior rectal artery. Above the celiac trunk, we have another parietal branches, which is not here, which is inferior phrenic artery, is the supplying the inferior surface of the diaphragm. Then this abdominal aorta at the level of L4 approximately is divided to the two common iliac artery, the common iliac artery, and at this bifurcation of the abdominal, it's continuation of aorta as a median sacral artery, which is not seen here. So then the common carotid, the common iliac artery, in this place, it continues. It doesn't have any specific artery. Just they give some branches for the muscles, and then it's here at the level of the sacroiliac joint. It's divided to the external iliac artery, which is passing under the inguinal ligament, and it's continue as a femoral artery, and then it gives the internal iliac artery, which is supplying the parietal and giving off the parietal branch and visceral branch for the blood supply of the organ in the lesser pelvic. So here also the common carotid is common iliac artery, and here is the external iliac, and here is the internal iliac at the level of sacroiliac joint. So it was a nice preparation that I wanted to share the blood supply of the branches of the abdominal aorta that we have it. Here again you can see the fibrous capsule, and here it's the ureter, and here also it's the ureter. So here you have another variation about the ureter. As you see, here is the kidney, here is the renal vein, here is the renal artery and the branches, and from the hilus of the kidney you can see that it's coming two ureters. So this is one ureter, and the other is the second ureter that it's coming from the renal hilus, and it's going caudally, which is also interesting. So here you have the sagittal section through the kidney. As we mentioned it before, the surface of the kidney, it's the color is approximately the reddish and brownish color, and the surface is so smooth and is covered by the fibrous capsule that we are going to discuss in the section of the covering of the kidney. In the sagittal section of the kidney, you can see two macroscopical structures that, according to the color, they are different. On the surface of the kidney, which is approximately 5 till 8 millimeter, it's the renal cortex. The color is much more lighter, and is extended toward the hilus, like a renal column that we are going to discuss. This is the first part, and this renal cortex, it contains the glomerulus and the convoluted part of the tubules of the nephron that we are going to discuss. And the second part, that the color is much more darker, is called medulla, and they are formed by the pyramidal shape structure, which are called renal pyramids. And these renal pyramids, they have the apex toward the hilus and the sinus of the kidney, and the basis is toward the cortex of the kidney. So this pyramid are approximately, this variation, the number approximately 6 till 20 in number, and between the pyramid there are the structure of the cortex that is extending between the pyramids. So here, and here they are called renal column, and this renal column, it's separating the renal pyramid from each other, and it's the material of the cortex that is from the surface. It's reaching toward the hilus of the kidney. So at the apex of the papilla, we have some opening which are called the papillary foramen, and this papillary foramen, this opening, they are as a matter of fact, they are the ending of the papillary ducts that they are formed by the junction of the collecting ducts that we are going to discuss in microscopical part of the kidney. So these foramens, through these foramens, papillary foramens, the urine is transmitted to the another part of the urinary tract, which are the minor calyxes that we are going to discuss. And the opening of this papillary foramen inside the area which is called the cribriform area or area cribrosa, and
is the structure that is produced by the orifice of the uriniferous tubules. So those are the general and the most important structure that we have it in the sagittal section of the kidney, and then we are also talking about the structure which are called renal lobes. The lobes of the kidney, it's composed of the one medulla or pyramid with the corresponding cortex or cortical part above that. So this is called the renal lobes, and they are variable in number. So as we said that the cortex is from the surface is radiating toward the hilus like a renal column. Also we have some radiation of the medulla inside the cortex, and it's called the pars radiata corticis or stria medullaris corticis, or medullary rays, the English terminology. That is the extending of the medulla toward the cortex at the base of this pyramid, and they are composed of the collecting tubules which are extending radially. So those are the general structure that you have to know it for the sagittal section of the kidney. So this is the sagittal section through the kidney. As we mentioned it, in the sagittal section of the kidney, you can see the structure of the kidney. From the surface of the kidney, here approximately 5 till 8 millimeter is the structure which is lighter color, as you see here. It's the structure of the cortex. So then after the cortex, then you have this structure which looks like a pyramid shape. This is the medullary part of the kidney, and it's called renal pyramids. The renal pyramid has the base toward the cortex and had the apex that it's toward the hilus or hilum of the kidney. And at the apex of this renal pyramid, you have the small opening which are called papillary foramens, that they are opening of this papillary duct, that they are opening to the ara cribrosa or cribriform area, and then it goes to the minor calyxes. So between the renal and this renal pyramid or medulla, they are darker in color. And between the renal pyramid, this is one renal pyramid, this is second renal pyramid, this is, for example, one, this is second, and this is third. So between this renal pyramid, so you can see the material of the cortex that is extended toward the renal hilus. This is called renal column, and renal column, as you know, it's the cortex, is the cortical part, is the extension of the cortex from the surface. It goes deep to the renal hilus, and vice versa. We have some extension of the medulla or the pyramid toward the cortex, that is called stria medullaris, stria or the medullary rays, they call it, that it's extended toward the surface of the cortex. In the cortical area here, generally you can find microscopically the glomerulus and most of the convoluted part of the tubules, and in the juxtamedullary nephron to the pyramid, it's extending the loop of the Henle, and then coming back as a straight part of the distal, and then the convoluted of the distal back to the cortex. In the column or the renal column, which is the cortex, it's passing the interlobar artery till the level of the base of the pyramid, and then always it divided to the two arcuate artery at the base and the border between the cortex and medulla, which is the base of the pyramid. So, and then here there are the area, the cribriform area or ara cribrosa, which is continue with the calyxes that I already mentioned. So as we mentioned, the main blood supply of the kidney is arising from the abdominal aorta at the level of approximately L1. And it's going toward the hilus of the kidney, the place of the entrance of the vessels and renal pelvis, and entrance and exit of the vessels and renal pelvis. This renal artery, after is coming to toward the hilus of the kidney, is divided to anterior branch and posterior branch, or peripelvic branch and retropelvic branch, because it's going in front of the renal pelvis, and this one it goes to the posterior to the renal pelvis. The peripelvic branch or anterior branch then further it's giving 4 branches that you can see. Those branches that are called segmental branches. And the posterior, this is view from posterior side, and the posterior branch or retropelvic artery, it's giving only 1 branch, which is also called segmental artery. The name of this segmental artery, they are the anterior branch. It gives 4 segmental artery, which is the superior, the anterior superior, anterior inferior, and the inferior segmental arteries. And the posterior branch or retropelvic branch of the renal artery, it gives only 1 branch, which is called posterior segmental artery. So in this case, if you look at the kidney, so altogether the kidney has 5 segments, and it's according to the distribution of the branches of the anterior branch and posterior branch of the renal artery. And the name of the segments of the kidney, they are the same name of the segments of the name of the segmental artery. It means that the segments of the kidney are superior, anterior superior, anterior inferior, and inferior segment. This is from the view from anterior side. This is the view from posterior side. This is the posterior segmental artery. From the posterior side, you can see also the superior and inferior segmental artery, that they are belong to the or is the branches of the anterior branch of the renal artery. So here is posterior part of the kidney. It's removed. The posterior surface of the kidney is removed. As we mentioned, the anterior side, here is the renal vein, and then we have the renal artery. And this renal artery, after is coming inside the hilus, the renal hilus, then is divided to the segmental artery. And as we mentioned it, we have the 5 segments that 4 of them it's a branch of the anterior branch or peripelvic branch, that is superior, the anterior superior, anterior inferior, and inferior, and 1 branch which is the branches of the retropelvic part or the posterior branch of renal artery, which is the posterior segmental artery. So according to the pathway of this segmental artery, we divide the kidney to the 5 segments, and this segmental artery, as we mentioned, they don't have any anastomosis and they don't have any collaterals artery connection together. The segmental artery, then further they are dividing to the lobar artery regularly for each lobe of the kidney. So we have the lobar artery, and lobar artery then it gives the interlobal artery. This is the interlobal artery that they are passing through the renal column. So they are passing to the material of the cortex and cortical structure. And this interlobal artery, they are located between the pyramids. So this is one pyramid. It means that they are forming the medulla, and here it's the cortex. So you can see this is the area of the cortex, And here is the area of the medulla. Here is the apex of this medulla or renal pyramid with the opening, the papillary foramen. And here is the border or the base of the pyramid, which is the border between the cortex and the medulla. So this medulla plus the cortical hood above that, they are forming one lobe of the kidney. And this artery that is passing through the renal column, and it's interlobar artery that is going toward the cortical area, and at the border of the cortex and medulla, which is this purple color, it's the border of the cortex and medulla, and as a matter of fact, it's the base of the renal pyramid. At this place, usually it's divided to the always two arcuate artery or arcuate artery that is it's seen at the level of the border between the cortex and medulla. From the arcuate artery, then further to the cortex, it's arising several arterioles or artery, which is called the interlobular artery. Interlobular artery, it's the branch of the arcuate artery, which is has another name, which is called arteria corticalis radiate, or the better is interlobular artery. Interlobular artery, when it's coming up to the cortical area, then it's giving a small branch which is called the afferent glomerular arterioles. Afferent glomerular arterioles, or simply they call the vasa afferentes. And this afferent arterioles is turning around itself, and it's making a structure which is called glomerulus, renal glomerulus, that we are going to discuss. And from the renal glomerulus, it's exiting another small arterioles which are called vasa efferent or arteriola glomerularis efferentis, which is coming out from the glomerulus. So afferent, vasa afferent is going inside the glomerulus, is turning and is making the glomerulus, and vasa efferent is coming out of the glomerulus. So what is important in the blood supply of the kidney, all this artery that we said, segmental artery, interlobar artery, arcuate artery, interlobular artery, vasa afferent and vasa efferent, they don't have any anastomosis between. They don't have any collaterals or any anastomosis between each other. So this is clinically important. One thing, and also all this artery that I mentioned it till now, it's responsible for blood supply of the cortex. It means for blood supply of the cortex, the typical cortex above the base of the pyramid, and also the renal column, which is the structure of the cortex. The only artery which is supplying the medulla, as you see here, and here also, and it's the branch of the vasa efferent, arteriola glomerularis efferentes, is these arterioles, which is called straight arterioles or vasa recta. Vasa recta or straight arterioles is the only artery that is supplying the medulla or the pyramid, which is branch of the arteriola glomerularis efferentes or vasa efferent. So here is the all blood supply of the kidney, the artery blood supply of the kidney. Vice versa, it's the venous blood supply. Venous blood supply, we have to start it from the surface of the cortex that we can find. On the surface of the cortex, the small venules that they are called satellite venules, and sometimes macroscopically seen on the surface of the kidney like a bluish color spots, and those are the satellite venules, and they are taking the blood, the venous blood, and they are carry it to the interlobular venules or veins, and interlobular veins, they are draining to the arcuate veins. The arcuate veins, the same position that the arcuate artery is located, and arcuate vein then is draining to the interlobar vein, and interlobar vein finally it's going toward the hilus of the kidney, and finally drain to the renal vein, and the renal vein finally to the inferior vena cava. And that the structure that from anterior to the posterior at the hilus of the kidney, we already mentioned that the most anterior is the renal vein, then is anterior branch of renal artery, then the renal pelvis, and then is posterior branch of the renal artery. So those are the structure of the venous structure, and also all these veins that I mentioned, they are the venous drainage of the cortical part of the kidney, and again the only veins that they are taking the blood from the medullary part or the pyramidal part is the straight venules, or the recta or recta venules, the veins that they are draining to the arcuate vein. So another important things opposite to the branches of the artery, the veins or the branches of the veins, they are anastomosing with each other, and they are connecting to each other, and this is opposite to the renal artery. So it's the branches of the renal artery. So that's all about the blood supply. That is very important. And now we are going to discuss the functional unit of the kidney, which is nephron. As we mentioned, that the interlobular arteries, they are giving then the vasa afferens. This is the vasa afferens or arteriola glomerularis afferentes, which is here is turning, and they are making a network of the vessels as a tuft, which is called renal glomerulus. The plural is the glomeruli. So this renal glomerulus, the size is approximately 200 till 300 micron, and they are usually located at the cortical area of the kidney. And after the formation of this vascular tuft, then another arteriole is exiting, which is called the vasa efferent or arteriola glomerularis efferentis. It's coming out of this glomerulus, the glomerulus. Each glomerulus it's contain the capsule, which is called glomerular capsule, the glomerular capsule or Bowman's capsule. The glomerular capsule or Bowman's capsule, it has two layers. One layer, which is the outer layer, which is covering the glomerulus, and the other layer, which is the inner layer, which composed of the cells which are called podocyte. The podocytes, they are called because they have the extension, the long extension over the surface of the vessels, and that's why they call it podocytes. And between the podocytes, they are the ultra space that is called pedicels or pedicles, they call it. And through this two layer of the Bowman's capsule or glomerular capsule, there is a space which is called the capsular space. And when the blood is passing through this vasa afferens and it passing through the glomerulus, the very important function of the kidney, which is called the filtration. The filtration, it's a glomerular filtration, is happening through the septum, that it composed of 3 layers that I'm going to discuss. And through this 3 layer, or through this filtration septum, the primary or primitive urine, it's accumulating here at the capsular space. So for your information, each minute 1.2 till 1.3 liter of the blood is passing through the kidney. And in this case, in 4 till 5 minutes, all the blood that you have in your body is passing through the arteries of the kidney. So in this case is important that the glomerular infiltration is important, because the primary or primitive urine that is happening and is accumulating in the capsular space here, it's approximately 180 liter per day is production. And it's impossible, as you know, but we have another part of the nephron that I'm going to discuss in next part, that there are the tubular system that the nephron has, and inside this tubular tubular system, the reabsorption or selective reabsorption of this primary urine is happening through this tubular system, and then final production of the urine is approximately 1.5 liter per day. So it's not 180 liter per day. So this is thanks to the selective resorption of the electrolytes and mainly the waters that is happening in the capsular space, and its production is produced in capsular space, and then it continues to the tubular system that is happening, the absorption in this case. So this is all, and now I'm going to talk about this filtration place or septum that when the blood is passing through these arterioles and glomerulus, we have 3 layers. That through this 3 layer, the primary urine is accumulating here in the capsular space, and slowly is continue to the tubular system. So here you have in this picture, you can find the filtration septum, that the blood, when it passing through the endothelium or through this capillary or vasa afferens, you see that in the wall of the vasa afferens you can see some fenestration. This is the fenestration that the content of the primary urine it passed through this fenestration. Then the second layer that you can see here is the basal membrane that is between the endothelium of the capillary and the inner surface of the Bowman's capsule, that is produced by the podocytes. And as we said, that this extension of the podocytes, they have the ultra pores between them, that it's called the pedicles or pedicels, and then through all these 3 layers, the primary urine is accumulating in the capsular space that you saw. So now in this part I'm going to discuss about the functional unit of the kidney and the basic structure of the kidney, which is called nephron. What is nephron? Nephron is composed of glomerulus that we already mentioned, plus the Bowman's capsule or glomerular capsule that we already mentioned. These two, the glomerulus and Bowman's capsule or glomerular capsule, they called the renal corpuscle or Malpighi corpuscle. Renal corpuscle or Malpighi corpuscle. So this is the terminology for these two parts, the glomerulus and the Bowman's capsule. Then this is the first part of the nephron. Then it's starting, as I said, the tubular system that you can see it here. So the first part of the tubular system is called proximal tubules. The proximal tubules, first part, it's turning. It's called the convoluted part, and then it's continue as a straight toward the medulla. So, as we said, the glomerulus and Bowman's capsule, or renal corpuscle, or Malpighi corpuscle, they are located in the cortex. Then the convoluted part also is located in the cortex of the kidney, and whenever we are going toward the straight part or vasa or the pars recta, it's going toward the medullary part or pyramidal part of the kidney. After the pars contorta and pars recta, or convoluted and straight part of the proximal tubules, which is in this part, the selective reabsorption, it's mainly happening in this tubular system. It means that the water and electrolytes, they are absorbed mainly through this part. Then it continues toward the medulla and toward the, as we mentioned, the apex of the pyramid. This loop of the tubular system, which is called loop of the Henle. Loop of the Henle, its part is composed of descending part and ascending part of the loop of the Henle, that is going and is directed toward the apex of the pyramid, and then the ascending part is going back toward the cortex. So also it's divided to the narrow part of the loop of the Henle and thick part of the loop of the Henle, which is continue toward the cortex. After the ascending part of the loop of the Henle, we are continuing to the last part of the nephron, which is called distal tubules. Distal tubules is starting as a straight part, and then it's continue as a convoluted part, or pars recta and pars contorta. And here this green that is finishing and the distal tubules is finishing, the nephron is finished. So very important about the functional unit and the basic structure part of the kidney is glomerulus and Bowman's capsule. It means the Malpighi corpuscle or renal corpuscle. Then it continue as a proximal tubules, which is divided to the convoluted part and a straight part. Then is continue with the descending part of the loop of the Henle and the ascending part or thin segment and thick segment of the loop of the Henle. Continue with the straight part of the distal tubules and the convoluted part of the distal tubules. And here the nephron is finishing. Then what will happen? That through this system of the nephron, we mentioned through this glomerular and Bowman's capsule, the glomerular filtration happening, and the primary urine is produced here, which is 180 liters per day. Then the urine is continued to the proximal tubules, and through this tubular system, their selective resorption is happening. The selective resorption is happening, and the waters and electrolytes, it's absorbing to the blood, because around this tubular system, all this tubular system, there are the peritubular capillary network of those arteries and veins that I already mentioned. So whenever you see all this tubular system, you see around them the network of the capillary vessels, and they are contacted with the capillary vessels with this tubular system. So the blood can be reabsorbed, or the electrolytes from the tubular system, it can go to the blood system. And also the last function of the nephron is the secretion. Secretion, it means that vice versa, because here around we have the peritubular capillary system, so some structure from the blood also it can release to the tubular system, and then it will be in the final production of the urine. It means, for example, some medicine or medication that you are taking and is expelled by the urine, it's that in your blood, then when it comes to the blood that is in the peritubular capillary, it can be secreted to the tubular system, and then from the tubular system continue and it's expelled from the body as a urine. So the three main function of the nephron is glomerular filtration, the selective resorption, and the secretion is the nephron. So here we reach to the last part of the nephron, which is called distal tubules. Then these distal tubules, they are draining to these ducts that they are called collecting ducts. Be careful, collecting ducts, they are not a part of the nephron, but each nephron via these distal tubules, they are open or they are drained to the several collecting duct, and this collecting duct that they are receiving the urine from the different left or several nephrons, also they are connecting together and they make the papillary duct, and this papillary duct finally at the apex of the pyramid, it's open to the ara cribrosa or cribriform area, and it will enter to the minor calyx, and then the pathway of the urine it will be continuous. So this is important that the position of this collecting duct and the papillary duct, they are toward the apex of the pyramid, which is in the medullary part, and here is the papillary foramen that are already mentioned. So this is about the nephron. So in this picture you can see the two type of the nephron that we have it. One nephron that it has a long loop of the Henle, that you can see that it's reaching the loop of the Henle to the deep to the medullary part, and it's called juxtamedullary nephron. And the other nephron that you can see here, it's the cortical nephron, that its main part of the nephron is located in the cortex, and they have very short loop of the Henle that is just reached to the proximal part of the medullary part, medulla of or pyramidal part of the kidney. And here, as I mentioned, around all this part of the nephron, there are the capillary network of the plexus of the venous and arterial plexus, and they call it peritubular capillary plexus, that all this tubular system, they are connecting with this blood system for the resorption and secretion. For example, in the cortical part, the kidney is producing the prostaglandin, in the medullary part is producing the erythropoietin, which is the hormone that is stimulating the bone marrow for the production of the red blood cells, and this is also it's producing, the kidney is producing renin that I'm going to discuss about which cells is producing the renin, that it's regulating the blood pressure, and it's produced by the juxtaglomerular cells or JG cells in the wall of the afferent, mainly afferent arterioles, that is producing the renal that is regulating the blood pressure and the absorption of the sodium mainly in the distal tubules. So here is the two type of the nephron, just to know that the juxtamedullary nephron and the cortical nephron. The juxtamedullary nephron, they have the long loop of the Henle, and the cortical nephron, they have the short loop of the Henle. As you see here, you can see the thin segment, and here is the thick segment of the loop of the Henle. So another term that you have to know is the regulatory mechanism of the kidney, which is called juxtaglomerular aperture or juxtaglomerular complex. Juxtaglomerular complex is composed of three cells that they are very important. As you see again, this is the vasa afferent, which is making the glomerulus or the capillary tuft. And here is the vasa efferent that is coming from the glomerulus out. Here, this green one, it's the cross section through the distal tubules, almost at the boundary or the border between the straight part and the convoluted part. And here on the wall of the vasa afferens, mainly vasa afferens. In some literature also you can find that it also is a part of the vasa efferents. You can see cells that, as a matter of fact, they are the modification of the smooth muscles cells of the wall of these arterioles, and they have the dense granules, and these cells, they are called juxtaglomerular cells or JG cells. These cells, they are responsible for production of the renin that I already mentioned it, that is playing role for the regulation of the blood pressure and absorption of the sodium from the distal canals. So this is the first part of the juxtaglomerular complex. Then we have another cells that is located at the distal tubules, that they are approximately, I said that in the border of the straight and convoluted part, but this part of the distal tubules that is sitting between the angle of the afferent and efferent arterioles is called macula densa. These cells, they are called macula densa, and this is part of the juxtaglomerular complex that is responsible for the regulation of the osmolarity of the urine. And finally, the third cells that belong to the juxtaglomerular complex is this mesangial cell. These mesangial cells that they are located again between the JG cells and macula densa here. And for a long time the function of these cells, it was not clear, but nowadays they are talking that these mesangial cells, they are responsible for the phagocytosis. So they have the ability to phagocyte the unwanted or the bacteria or the foreign body that is located in this area. So these three cells, the JG cells or juxtaglomerular cells, and the macula densa at the distal tubules, and the mesangial cells, all together, they are the three cells that they are making and forming the juxtaglomerular aperture or juxtaglomerular complex for the regulatory mechanism of the kidney. So regarding the position of the kidney, as we said, that the kidney is located in the retroperitoneally and according to the peritoneal cavity, and it's located approximately between the level of the T12 till L2 and sometimes L3, because as you know, by the respiration, by the inspiration and expiration, so the position of the kidney, it will be different. For example, in the deep inspiration or inhalation, so the kidney is moving downward approximately 3 centimeters. So this is the view from the posterior side, and in this case, this is the right kidney and this is the left kidney. And as you know, the right kidney, it's at the height, the same height of the one vertebra. It's lower than the left kidney because of the weight of the liver on the right side that is pushing the kidney a little bit downward, approximately to the size of the height of the one vertebra. So the posterior relationship of the kidney in the superior 1/3 is covered by the diaphragm. The kidney in the superior 1/3 is covered by the diaphragm, and the inferior 2/3 of the kidney, it's sitting on the three muscles that from the medial side to the lateral side. They are the psoas major here, then the quadratus lumborum, and then the transversalis abdominis muscle. So these three muscles, they are the place that the lower 2/3 of the kidney is sitting on this place. In the upper part of the kidney, in addition of this diaphragm, also there is a passage of the 12 ribs, definitely, and sometimes also you can find the rib number 11 also. In the posterior part of the kidney, between the diaphragm and the rib number 12 to the posterior part of the kidney. It's reaching the costodiaphragmatic recess. So the costodiaphragmatic recess of the pleura, it's reaching to the posterior part of the kidney as well. Also, the posterior relationship of the kidney under the 12 ribs, it's is a subcostal nerve, and also the iliohypogastric nerve and ilioinguinal nerve. Also, they pass posteriorly from the kidney. They are arising from the lumbar plexus, and they have the posterior relationship to the kidney. So this is the part of the kidney that we already mentioned it. So the superior one-third is covered by the diaphragm, and it's also the posterior relation, as we said, the 12 and 11 ribs, and the nerve, the subcostal, iliohypogastric, ilioinguinal nerves, and the lower part that is sitting on the three muscles from the medially to the laterally, the psoas major, quadratus lumborum, and transversalis abdominis. So in this picture you can see the anterior relationship of the kidney. It means that the organs that are lying over the anterior surface of the kidney. We have different in the right kidney and left kidney, and as you see again from the anterior view, the right kidney is a little bit lower and the left one is a little bit upper position. So in anterior relation of the kidney, we have the organs that they are sitting over the kidney. In this part of the kidney is covered by the liver. Above the kidney and a little bit more medially, it's the suprarenal or adrenal glands. At the level of the hilus of the kidney or hilum of the kidney, you can see that it's the descending part of the duodenum. It's projecting on the hilus of the kidney. Then it's followed caudally by the right colic flexure, the place that the ascending colon, it's continue with the transverse colon, and here the lower and medially, it's the position of the small intestine, mainly the jejunum. It's located here. So here there are the organs that they are in the right kidney, and they have a relationship with the anterior surface of the kidney. And in the left side, we have different organs. So again, superiorly and medially is the adrenal or suprarenal gland. Then it's followed by the stomach. So here is the area that the stomach, it has some impression over the anterior surface of the kidney. Lower that in the region of the hilus of the left kidney, there is a projection of the pancreas. So pancreas is reaching to the hilus of the left kidney, and it's making a place and projection over the anterior surface. And then again the same, this is the left colic flexure. When the transverse colon, it continue with the descending colon, and the lower and medially is again the small intestine, mainly the jejunum, is located here. The most lateral organ that is projecting in anterior surface and cranial craniolateral part of the anterior surface of the kidney is the spleen or lien, that you can see here the area. So once more, the suprarenal gland, the stomach, the pancreas, the left colic flexure, and the jejunum or small intestine, and the spleen. Those are the organs that they are projecting in anterior surface of the kidney. So here you have the cross section of the through the abdominal cavity to show you the covering of the kidney. For your orientation, here is the vertebra. So here is the posterior side. Here is the spine of the vertebra or spinous process of the vertebra. And this blue line is the peritoneum. So what is in front is the peritoneal cavity, and what is behind is the retroperitoneal organs. So as we mentioned it about the covering of the kidney. So here there are the kidney, and on the surface of the kidney you have the first, we are going from the superficial to the deep. So on the surface of the kidney we have this black line, which is a capsule of the, or fibrous capsule of the kidney. And this fibrous of the capsule of the kidney, it has usually two layers that is attaching on the surface of the kidney, and if you cut it, so you can easily remove it from the surface of the kidney. Then the next layer that is around the kidney, it's a fatty tissue which is covering all around the kidney and is called adipose capsule or fatty capsule of the kidney. So this is the next layer from the superficial, from the deep part to the superficial surface of the abdomen, or from the superficial of the kidney to the deep part. So here from the surface of the kidney, fibrous capsule, then is adipose capsule. After the adipose capsule, this green line that you can see, and it's very important, it's the renal fascia. Renal fascia, we subdivided to two parts. The fascia, or the part of the renal fascia which is in front of the kidney, is called perirenal fascia, and the part of the fascia that is behind the kidney is called retrorenal fascia. This perirenal fascia and retrorenal fascia, they are cranially and laterally, they are fusing to each other, as you see here. Medially, this fascia, they are going and attaching to the connective tissue that are covering the big vessels. Here, for example, the inferior vena cava, and here is the aorta, and it's continued to the other fascia. So this is medial direction. The only place that the fascia, they are not reaching to each other and it's open, it's the caudal part of this fascia. The caudal part or inferior part of this fascia is open, and it's allowing the kidney, in the special case, for example, if you lose the fixation of the kidney, for example, the adipose tissue here, it's very less, so the kidney, it's moving toward downward, and the name of this kidney that is moving from this original place downward is called ren migrans. So the kidney is migrating toward the downward because of, or thanks to, this opening of the only the caudal part of the perirenal fascia and the retrorenal fascia. So this is the important things for the ren migrans, that it's coming caudal. Then after the renal fascia, if we go more posteriorly, we have another fatty tissue that you can see it here, and this fatty tissue is called pararenal adipose body. The pararenal adipose body that is mainly is located in the posterior part, and we don't have it in the anterior part, or it's very less in anterior part. It's just in the posterior part, and then finally it reached to the fascia that it's covered by the covering the muscles. So it means that the psoas major, the quadratus lumborum, and transversalis abdominis muscle. From the perirenal fascia in front, then you have connection with the peritoneum. So here is the peritoneum, and in this case you are finishing the covering of the kidney. It means I'm going from the superficial part of the abdominal cavity. So if I cut here the abdomen, the anterior wall of the abdomen, and I go inside the peritoneal cavity, then I have to cut the peritoneum to reach to the retroperitoneal space. So when I cut the peritoneum, the first layer from anterior side toward the posterior. So I'm going from the anterior side to the posterior side. So I cut the peritoneum, then I reach to the perirenal fascia, then I reach to the anterior part of the adipose capsule of the kidney, then I reach to the anterior part of the fibrous capsule of the kidney, then I remove the kidney out, and then I will reach to the other part, the posterior part of the fibrous capsule of the kidney, then is posterior part of the adipose capsule of the kidney, then is the retrorenal fascia, and then is the pararenal adipose body, and then the transversalis fascia, which is covering these three muscles that is in the posterior relationship of the kidney. So finally, also the kidney, according to the position of the kidney, it's the lower pole of the kidney reaching under the mesocolon transversum. So in this case, the part of the kidney or lower pole of the kidney, it can be palpable through the inframesocolic part of the peritoneal cavity. Regarding the fixation of the kidney in the place, the fixation of the kidney is made by this renal fascia, the peri and retrorenal fascia, by the adipose tissue that is around the kidney is located, the renal capsule and the pararenal adipose tissue, and also it's playing role for the fixation of the kidney. Also, the intra-abdominal pressure and tonicity of these muscles, they are playing role for the fixation of the kidney. So those are any of this fixation that is disappear. For example, for a long time, if the patient will be hungry and hungerness, and also after the delivery or pregnancy, so the fatty tissue that is it's diminished the number, so the kidney can move it only in the caudal direction, which is called ren migrans that we already mentioned. So in 2% of the population, the shape of the kidney is a little bit variable than the normal shape of the kidney. That's why they call it the dystrophic kidney, but the function is preserved. So normally they have their own function and the normal function, but the shape is different. So different shape of the dystrophic kidney, it can be lobulated outside. We said that internally the kidney was divided to the several lobes, but outside it was smooth. But here, as you see, it's the lobulated kidney, which is called renculisatus. Then if the kidney, the lower pole of the kidney, they are attaching together, they make the arcuate kidney. Or two kidney, they are sitting over each other, they call it duplex. Or the superior pole, it's connecting with the inferior pole of the other kidney, is called the sigmoid kidney. And also, if the two pole of the kidney, superior and inferior, they are connecting together, it's called fungiform. It looks like a cake shape. It's called the fungiform kidney or ren fungiformis. So this is the dystrophic kidney, that the shape is variable but the function is normal. And finally, the innervation of the kidney, it's made by the autonomic nervous system, and they are coming from the celiac ganglion, from the celiac plexus, and also from the ganglion at the level of the renal artery. And the sympathetic, it's from the minor splanchnic nerve that it's innervating, and also the sensitive innervation of the kidney is just reaching to the fibrous capsule. So the parenchyma of the kidney practically is it doesn't have any sensitive innervation. So as we mentioned that the urine, the primary urine was produced at the capsular space by the glomerular filtration. Then the urine was passing through the tubular system of the kidney, the proximal loop of Henle distal tubules. Then distal tubules, they are opening to the collecting ducts, and several distal tubules of the several nephrons, they are open to the these collecting ducts, and these collecting ducts also they are joining together and they make the papillary ducts, and these papillary ducts at the apex of the pyramid, renal pyramid or medullary part of the cortex at the papillary foramen, they are opening to the cribriform area, and this cribriform area, then the urine is transmitted toward this structure that they are called calyxes. Calyces, or there are two types of the calyces we have, and those are the tubular extension of the renal pelvis of the varying lengths, and the function is the reception of the urine from the renal papilla. Those calyces, we divide them to the two types. The minor calyces, that there are several, approximately 7 till 13 cup-shaped structure that you can see, and they are derived from and they are joining together and they make the bigger mostly 3 or 2 structure that they are called major calyxes. And these major calyxes then finally they are joining together and they make the renal pelvis, which is coming out of the hilus of the kidney. So after the passage of the urine, the final component of the urine, because through the tubular system we said that the selective resorption and secretion is happening, then this calyxes minores, or the minor calyces, they are receiving the urine from the papillary foramen, and they are joining together each 2 or 3 these minor calyxes, and they make finally the major calyxes, and major calyxes they are joining together and they make the renal pelvis. This renal pelvis that you can see it here and here, they have the triangular shape, and they are located at the hilus of the kidney. On the right side, we said that it's projected over this renal pelvis is projected at the hilus of the kidney, is projecting the descending part of the duodenum. At the left side is projected by the cauda, or the tail of the pancreas. And this is the part, or the funnel shape structure that it's initiating this or making or forming the initial segment or section of the ureter, which is inserted in the renal sinus. So the capacity of the renal pelvis is approximately 3 till 8 milliliter. It's important that the surgical capacity above the 5 milliliter if there is an obstruction in this region. So, and the capacity is more than 5 milliliter, it can produce pain in this the abdominal cavity by this renal pelvis. And also, according to the junction of these minor calyxes together and major calyxes and forming the renal pelvis, we have two types. The ampullar part, which is here, it's the bulky shaped renal pelvis, and the short renal calyxes we have it. But in dendrite or dendrite type of the shape of this structure, the renal pelvis and the calyxes, we have the long stem of the calyxes and narrow shape of the calyxes, and also the size of the renal pelvis is much more less than the ampullar part. So the ampullar shape and the dendrite shape according to the connection of the minor calyx and shape of the renal pelvis. So the structure that we have it in the renal pelvis. So generally in the urinary tract, the first layer is the mucous layer that is covered by the epitel, and the epitel of the urinary tract is the transitional epitel, and the exception is just the apex of the papilla, at the papilla apex of the renal pyramid, which are cylindrical epitel, and finally the submucosal layer, and then the muscular layer. Be careful, the muscular layer in the urinary tract is vice versa of the GI tract, because in urinary tract the outer layer is the circular and inner layer is the longitudinal. In GI tract it was the outer layer is longitudinal and inner was circular, that here in the urinary tract is vice versa. And then finally the outer layer is the adventitia that is covering the part of the urinary tract. And here you can see the ureter, and if we go up there, here you can see the renal pelvis that or pelvic renalis that we said that the capacity is approximately the 3 till 7 milliliter, and 5 milliliter is causing the pain due to the obstruction or urinary stone, for example. And here there are the calyxes. So here you can see the calyxes that they are joining together and they make the major calyxes here, and the major calyxes also they are joining together and they make the renal pelvis. Here maybe it's better seen after we remove the arteries. So here there are the calyxes that you can see here, and here, and the minor calyxes they are joining together and they make the major calyxes, maybe 3 or 4. And this major calyxes they are connecting together and they make this triangular shape structure which is called renal pelvis, and the renal pelvis is coming out from the hilus of the kidney, and then it continues as a ureter. So this is the structure. So next part of the urinary tract is ureter. Ureter is the retroperitoneal tube that is connecting the renal pelvis to the urinary bladder. So this ureter, the length, it approximately is 25 till 30 centimeter. The diameter of this ureter is varied between the 4 till 7 millimeter. It's coming from the place that the renal pelvis is end, and it's ended to the orifice on the side or lateral side and cranial part of the urinary bladder as a ureteric orifice. So this is the ureter, and the ureter is according to its pathway, it has 3 parts. The first part is the abdominal part. That is starting from the end of the renal pelvis till the place that the ureter is crossing over the iliac vessels. So it means that maybe specifically on the left side is crossing the common iliac vessels, and in the right side is crossing the external iliac vessels. So this place, that is the borderline between the abdominal part and the pelvic part, is called terminal line. This yellowish color, that is terminal line. And terminal line is the place that this ureter is crossing over the iliac vessels. After the terminal line, another part of the ureter is the pelvic part, that it's passing through the lesser pelvis, and is the section of the ureter that is starting from the terminal line to the wall of the urinary bladder. And then finally the last or smallest part of the ureter is the passage of the ureter through the wall of the urinary bladder, which is called intramural part. So once more, the abdominal part, the retroperitoneal passage of the ureter, then till the terminal line, then the pelvic part in the passage of the ureter through the lesser pelvis, and then intramural part, which is the place of the ureter that is penetrating the wall of the urinary bladder, which is end up to the ureteric ostium or orifice to the urinary bladder. It's important, the topographical anatomy of the ureter, that during to its pathway, it's crossing different structure. For example, ureter is crossing the testicular or ovarian vessels, testicular in male or ovarian in female, and it's crossing them in front of the psoas major muscle, and the ureter, according to these vessels, testicular or ovarian or gonadal vessels, they are going under it. If you want to find the intra-abdominal part of the ureter, you can find the psoas major. So on the anterior surface of the psoas major, you can find the ureter, and in front of the ureter, it's this testicular or ovarian vessel. So it means that ureter is crossing under the testicular vessels. Then ureter also is crossing over the nerve, which is called genitofemoral nerve, that you can find them on the anterior surface of the psoas major, of course, but ureter pass in front of or over them and is crossing them. Next structure is the iliac vessels that I already mentioned. This ureter at this place is crossing on the left side the common iliac vessels, and on the right side the external iliac vessels at the level of terminal line, and they are crossing them in front of them, so it's over them. Then also in the pelvic region, the ureter is crossing the ductus deferens in male, and is crossing under the ductus deferens, and in female it's crossing under the uterine artery. Is very important place that the ureter is passing and crossing the ureter, the uterine artery under it, passing under the uterine artery. This place is important because in this place you can find the very important lymphatic drainage of the uterus, which is called Bayer's lymph node, is a part of parauterine lymph node, and is located approximately 2 cm from the margin of the uterus to the place that the ureter exactly it's going under the uterine artery, and it's called Bayer's lymph node. So this is the important lymphatic drainage of the uterus. So those are the structure, and finally the uterus, the ureter is going under the root of the mesentery, on the right side, and also the ureter also it's on the left side is crossing, and it goes under the mesosigmoidum, or the mesentery of the sigmoid colon. So those are the structures that the ureter is crossing, and it's important for the topographic anatomy during to its pathway. And another important is the clinical place. Clinical is important. It's the the narrowing place of the ureter. The ureter, according to its pathway, it has 3 constrictor place, or the narrowing place, that it's located by this arrow, and usually in this place the stone, the urinary stone, is trapped because it's the most narrowest part of the ureter. So the first narrowing place is at the level of the end of the renal pelvis, when the renal pelvis is end and ureter is starting. So this is the first narrowing or constrictor place of the ureter, which is approximately 2 millimeter. So we said that the diameter of the ureter is approximately 47 millimeter, but here you can see that the 2 millimeter. Then another narrowing or constrictor place of the ureter is this place at the level of terminal line that we already discussed. Is another constrictor narrowing, which is approximately 4 millimeter. And finally, the third narrowing place of the ureter is at the place that the ureter is passing through the wall of the urinary bladder, which is approximately again 1.5 millimeter is the narrowest part that of the ureter. So here it's staying or is trapped the urinary stone in this area, and is making a pain to the inguinal regions and the scrotum in male and the labia majora in the female, because this area is the same, they have the same innervation of the ureter, means from the iliohypogastric, ilioinguinal nerve and genitofemoral nerve, that they are taking the segment from the T10 till L2. So the manifestation of the pain of the urinary stone, that is called the colic pain. It's very severe pain and it's shooting and sharping pain. So this pain, it can be radiated to this region of the scrotum or labia majora or the inguinal region. So that's why they have the same segments of the innervation. So finally the structure of the ureter, as we mentioned it has the typical structure of the urinary system. It means inner layer is the mucous membrane composed of the transitional epithelium, and second is submucosal. The third is the muscular layer. Again, be careful, the outer is circular, the inner is longitudinal. Only in the part that the ureter it's entering to the urinary bladder, there is a additional outer longitudinal muscle that it becoming thickening. It's making the thickness of this part of the ureter that is called the ureteric vagina or valgular vagina of the ureter, and this is because that it's preventing the reflux of the content of the urinary bladder back to the ureter. So this is the prevention of the reflux of the urine from the urinary bladder to the ureter. So this is called valgular vagina. So this is the located at the orifice of the ureter or your ureteric orifice. So, and finally the outer layer is the adventitia, which is the collagen connective tissue that is covering this muscular area. So the place of the terminal line that the ureter is crossing these vessels, the iliac vessels. As a matter of fact, this ureter, it's the nearest. It has a nearest point toward the anterior abdominal wall. So that's why this part is called ureteric point. And it's located, and it will be found at the bispinal line between the outer and the middle third part of this bispinal or interspinal line, and this is the place that the ureter, according to its pathway, runs the most near relation with the anterior abdominal wall. So after the ureter that is open to the urinary bladder, this urinary bladder or vesica urinaria is another part of the urinary tract. This urinary bladder is located behind the symphysis of the pubis or pubic symphysis. In children, the urinary bladder is a little bit higher than in adult, and after the age of 6 years, so the urinary bladder is coming caudally. The urinary bladder is covered in the superior surface and a little bit of the or partly of the posterior surface covered by the peritoneum, as you see. And the other part of the urinary bladder, which is not covered by the peritoneum here, is covered by the adventitia, which is connective tissue, which has a general terminology as a paracystium. Paracystium is composed of the vesico-umbilical fascia, is composed of the septum between the rectum and urinary bladder is called the rectovesical septum, and in female between the vagina and the urinary bladder anteriorly, which is called the vesicovaginal septum. So this is the paracystium, which is allowing the urinary bladder to enlarge. And changing the shape of the according to the if it is empty or if it is full. So this part that is not covering by the peritoneum and is behind the symphysis pubis is called retropubic space, and this retropubic space is continue cranially between the, as you see, the peritoneum and the anterior wall of the abdomen. So in this space is allowing that if this urinary bladder is filled by the urine, so the apex is continue above the symphysis pubis and it's going upward, and if you want to gain access to the upper part of the urinary bladder, so you can do it above the symphysis pubis. It's accessible to the urinary bladder without penetrating to the peritoneum. So the shape of the urinary bladder is the ovoid shape, is the ovoid hollow organ. It has two main parts: the apex, which is directed cranially and anteriorly, and the other part is called the fundus of the urinary bladder, which is the floor of this urinary bladder is, and its look is directed dorso caudally. It's vice versa of the apex. So this fundus of the urinary bladder is directed in the male toward the rectum and toward the prostate, and also toward the seminal vesicles and toward the ampular part of the ductus deferens. So in female, the fundus of the urinary bladder is toward the cervix of the uterus and the vagina. So this is the part. Then between the apex and fundus, we have the widest part of the urinary bladder, which is the corpus, and is the widest part. And finally, the part of the fundus, which is the urethra, is coming out from the urinary bladder. It's the narrow surface of the fundus, which is called cervix of the urinary bladder. So four parts of the urinary bladder: the apex, the body, the fundus, and the cervix of the urinary bladder, which is the narrowing part of the fundus. That from here the urethra is starting. So the apex, as we said, is directed anteriorly and superiorly. The shape of the urinary bladder, as we said, that is ovoid shape and is a hollow organ. The shape of the urinary bladder, of course, is different, and it's related to that if it is empty or if it is full. Also, it's depend on the tonicity of the muscles of the urinary bladder, and also it depends on if it is male or female, or if it is old person or young person. So by the feeling of the capacity of the urinary bladder, be careful. The capacity of urinary bladder, we have physiological capacity of urinary bladder and maximum capacity of the urinary bladder. Physiological capacity of urinary bladder is approximately 300 till 350, they call it. But the maximum capacity of urinary bladder is reached to the 500 till 700 milliliter. So this is different if they will be asked by the physiological capacity is 300, 350. Its usual capacity of the physiological capacity, but the maximum it can reach to the 700 milliliter. Then by the increasing or by the filling of the urinary bladder by the urine, the anterocranial part, which is apex, is going above the symphysis pubis, approximately 5 centimeter above, and it reached to the abdominal cavity. Superior part of the urinary bladder is in contact with the content of the peritoneal cavity, which are the intestines, and here they are all about the part and the capacity and the shape of the urinary bladder. Regarding the structure of the urinary bladder, as usual, the most inner structure is the mucous membrane that is covered by the epithelium, the transitional epithelium, and under that is the submucosal layer that is the contain very long loose connective tissue, and that's why it's on the surface of the urinary bladder. Most of the part of the urinary bladder, you can see the fold that is helping for the saving and storage of the urine inside the urinary bladder. But there is in urinary bladder, specifically in the fundus, we have a specific part which is called the trigonum vesicae or vesical trigone. And this vesical trigone, they don't have this typical shape of the mucous membrane and submucosal layer, and then after that is the muscular layer. So this submucosal layer, the connective tissue in the vesical triangle is missing, and that's why the mucous membrane is directly adhered to the muscular layer. And in this case, we don't have these folds that you have it in other part of the urinary bladder. You don't have it in the vesical trigone. Where is the exact location of the vesical trigone? This is between the two ureteral orifice, not ureteral orifice. This is the orifice of the ureter that is coming from above and the side and is opening to the side of the urinary bladder. This is called ureteric orifice, and this ureteric orifice is connected together via the mucous fold, which is under that is the smooth muscle, and it's called interureteric fold. And the apex of this triangle is here, which is the beginning of the and is located anteriorly and is the beginning of the urethra, and is called the internal ostium of the urethra. So this is the place that the unpaired urethra is starting from here. So it's the beginning of the urethra and anterior tip of the vesical trigone. So here you have this border of the vesical trigone. So this orifice of the ureter, which is connected by the interureteric fold, and anteriorly it's by the internal urethral orifice. As we said, this trigone, in this trigone, this vesical fold is not existing. because there is no submucosal layer, and mucosal is directly firmly adhering to the muscular layer. Behind this interureteric fold, usually you can find pathologically, it means by the, for example, by the increasing the size of the prostate. Here you can find the retrotrigonal fossa that it's becoming very deep, this fossa, and it's caused the stagnation of the urine by the hyperplasia of the prostate, or the beginning of the enlarging or increasing the size of the prostate. It can happen. This is also another structure that you can find it here. It's at the place of the internal urethral orifice. There is a median elevation behind the internal urethral orifice and above the middle lobe of the prostate, which is called uvula, vesical uvula, and usually it's seen in male better than female, and this is just the mucous membrane and submucosal layer around the ostium internum, or internal orifice of the urinary bladder, which is containing the vascular plexus, and it's very well seen in male than female. And finally, in the lateral part of this triangle, there are the strip of the muscles that they are called Bell's strips, and they are making the lateral border of this triangle. So the contact surface of the urinary bladder to the rectum, it's superiorly was bordered and posteriorly is bordered by peritoneum. And in this place we have the place which is called interampular trigone. This is the trigone between the two ampular part of the ductus deferens in male, and this place is projecting to this area which is called vesical trigone, and about this ampulla of the ductus deferens we are going to discuss it in the male genital organ. So this is about the mucous layer and submucosal layer, and the next layer is the muscular layer of the urinary bladder, which is very important, and it has a specific name which is called musculus detrusor, or detrusor muscle. So regarding the muscular layer of the urinary bladder, as I said, it has a specific muscle, it has a specific terminology or name, which is called musculus detrusor vezitse. This is the synonymous of the muscular wall at the urinary bladder, and is not a typical two-layer that it was typically in the urinary tract, outer circular and inner longitudinal. But here we have three layers of the muscles that they are forming this detrusor muscles. The most outer layer, it's the longitudinal muscles, that muscle which is starting from the apex of the urinary bladder, and they are directed caudally, and it going on the side of the urinary bladder, and they are going a little bit obliquely. Then we have the inner layer, which is the middle layer. The middle layer is the circular muscle, and this circular muscle is the most important part of this circular muscle is located at the fundus of the urinary bladder, and specifically when it coming to the cervix or the neck of the urinary bladder, where the urethra is starting, is making the sphincter, which is called musculus sphincter vezitse, or the vesical sphincter muscle. It's the smooth muscle that is the inferior continuation of the smooth muscle, and it's making a sphincter that is continue this sphincter to the internal sphincter of the urethra and the prostate, and it's preventing the reflux of the spermia and urine back to the urinary bladder. So this is the middle circular layer, and finally the yellow one, that is the internal longitudinal muscle again, so which is making a plexiform layer. So because they are making like a plexus, so that's why they call it plexiform. It's the most weakest layer of the muscular layer of the urinary bladder, and here they are elevating this submucosal fold or submucosal connective tissue that is located under the mucous membrane. So for the recapitulation and simplifying the muscle of the urinary bladder or the detrusor muscle, we have outer and inner longitudinal and middle circular layer. So those are the important of the character of the muscles of the urinary bladder, and functionally the outer layer, as we said, the upper and partly the posterior part is covered by peritoneum, and the other part that is not covered by peritoneum is covered by the adventitia, which is the collagen connective tissue, and they are called as a paracystium that we already mentioned. And then from the outer layer we have another muscles that they are attaching usually to the neck or cervix of the urinary bladder. One of them is called pubovesical muscle, is a smooth muscle which is from the posterior side of the symphysis pubis in the lower portion. It's attaching to the neck of the urinary bladder. Then we have the rectovesical. It's the muscle that they are making a loop from the anterior wall of the rectum, and they are going around the cervix or the neck of the urinary bladder, and which is the portion of the fundus of the urinary bladder. This muscle also, it can be continued as a urethral muscle, which is in male, is extending from the longitudinal muscles of the rectum, and it goes to the male urethra. Then we have in the vesical trigone the trigone muscle or musculus trigonalis also is existing, and they are the external part of the except this trigonal muscle, they are the muscles around the urinary bladder. This is the recapitulation of the prostate. As we mentioned, that it has cranio-ventral part, which is apex, and dorso-caudal part, which is fundus, which is toward the rectum. Mainly here, from the apex is continue the ligament, which is called the median umbilical ligament, which is inside is the chorda urachus, is the remnant, embryological remnant of the urachus. Here is located, and under the peritoneum there is making a fold, which is called the median umbilical fold. We have, and is unpaired, and from the apex of the urinary bladder is connecting to the umbilicus. And then parallel with that, there are another folds that is called the medial umbilical fold, and the lateral umbilical folds. The lateral umbilical folds, they are under that, it's passing the inferior epigastric artery, and under the medial umbilical fold it passes umbilical artery. So here under the median umbilical fold is the urachus or chorda urachus. So then the widest part is the body, and the part that the urethra is starting is the cervix of the or neck of the urinary bladder, and those places, they are the place that the ureter is opening from the above to the side of the urinary bladder, and they are opening inside to the ureteric orifice. And the opening and closing of this ureteric orifice, and also internal urethral orifice is made by the contraction of the muscles of the urinary bladder, for example, trigone muscle or the vesical trigone muscle. So here there are the muscle which is pubovesical, and in male also puboprostatic part, because the prostate is immediately here is located. Then another muscle which is here that we said that is making a loop, it's the rectovesical muscle. In female, this rectovesical muscle, it's on the lateral wall of the vagina. It's going toward the the neck of the urinary bladder, and is making a loop around the urinary bladder. And in male, they are in the lateral wall of the prostate. And finally, only in male we have this muscle, because which is called the recto-urethral muscle, because in female, between the rectum and urinary bladder, here it's the uterus, which is continue as a vagina. So this is the recapitulation of this information that I said it before. So next part of the urinary tract is ureter. Ureter, the function is transporting the urine from the renal pelvis to the urinary bladder, which is open at the ureteric orifice or ostium. The length of the ureter is approximately 25 till 30 centimeter, and the diameter is variable between 4 till 7 millimeter. Of course, during to this pathway, we said that it has three main parts: the abdominal part, which is passing in the retroperitoneally, then it's after the terminal line, it enter to the lesser pelvis, which is called the pelvic part, then it enter to the wall of the urinary bladder, and it's called intramural part, and it's open to the ureteric orifice in this region. If you see, so here, for example, one, and here is the second one. As you see, the ureter, it's entering to the urinary bladder from the behind and in the side to the wall of the urinary bladder. This is one, and the other it's here, and this is the anterior part of the urinary bladder that in a while I'm going to discuss. Of course, ureter has three narrowing or constrictor places that the urinary stone, it will be placed in this area, and they make the very severe pain. One, it was at the beginning of the ureter when the renal pelvis is ending, the other when it's crossing the terminal line, and the last one when it's entering to the wall of the urinary bladder. So then here we have the urinary bladder. This is the male urinary bladder, because here under the urinary bladder we have a prostate, and here is the urethra, the male urethra, that we are going to discuss it in the genital system of the male. As I mentioned, the urinary bladder has an ovoid shape structure. The cranially and anteriorly is the apex, and posteriorly and dorsally and caudally it's the fundus of the urinary bladder. In the middle there is a body of the urinary bladder, which is the widest part of the urinary bladder, and at the place of the fundus that the urethra is starting or beginning, here they call it neck of the urinary bladder, or the cervix of the urinary bladder, or vesical cervix. Be careful, the Latin name of the urinary bladder is the vesica urinaria, so whenever you hear the vesica, we are talking mainly about the urinary bladder. So regarding the wall of the urinary bladder that I mentioned it already, so I try to open this wall of the urinary bladder. You see that in the inner layer we said that it has a mucosa covered by the transitional epithelium, and under that there is a submucosal layer that it has a relatively long loose connective tissue, and that's why it's making a fold here, and these folds are helping to storage of the urine inside the urinary bladder. So urinary bladder, we said that the capacity is the physiological capacity is 300 to 350 milliliter, but the maximum capacity it reached to the 500 to 700 milliliter. And then these folds, they are helping for the storage. But at the area of the urinary bladder, at the area of the fundus, you can see here is the fundus, and I open it here in this area, very nice. You can see we have 1 and 2. This is the ureteric ostium, this, and here it's the internal urethral orifice. So here, if I show you again, those are the place of the boundary here. You can see 1, 2, and 3. So this 1 and 2, those are the place of the opening of the ureter, and they are connecting by this fold which is called interureteric fold. Under that it's mucous membrane, and under that it's the muscular layer. And here it's the beginning of the urethra, and it's called internal ostium of the urethra, internal urethral ostium. And in this case you have this triangle that, as you see, doesn't have these folds. You see that here is the normal, that it has a fold. But here in the trigone, we don't have this fold, because the mucous membrane, it doesn't have under that the connective tissue, the loose connective tissue, and the mucous layer, it's firmly is attaching or adhering to the muscular layer. That the muscular layer that we said it already, it has 3 layers, which is called musculus detrusor, and outer and inner longitudinal and middle circular. So here in this side we have the Bell's strip, that they are the prominence of the muscular layer, and also behind this interureteric fold there is a fossa, which is by the enlargement of the prostate, mainly the middle lobe. So it can be causing the stagnation of the urine here in this area, and secondary, it can cause the urinary infection. So this is the urinary bladder. And then about the male urethra, we are going to discuss later at the genital system of the male. So in this preparation, I'm trying to show you the vesical trigone, which is very important. And here is very nice preparation that you can see here in this area. It's the orifice of the ureter, the ureteric ostium, here one. And here is another ureteric ostium here. And these 2 ureteric ostium, they are connected together by the interureteric fold. And here the apex of this triangle, this is the triangle, and the apex of this triangle is this opening, which is the beginning of the urethra and is the internal urethral orifice. So this is the vesical triangle that we said that we don't have these folds, the vesical folds, and the mucosa is firmly attached to the muscular layer. At this opening of the urethra or ureteric ostium, we have at the place of the entrance of the ureter, so here you can see the ureter, one ureter, and here is the second ureter. The another layer of the muscular layer, which is longitudinal, it's coming in this area, and they forming the valdier or the ureteric vagina, they call it. And this is the mechanism that is preventing the reflux of the urine from the urinary bladder back to the urethra. So here, if you look at it, the fundus of the urinary bladder, here you can see one ureter, and here you can see the second ureter, and here you can see that the fundus was directed toward the rectum, and also here is directed toward the prostate. Here is the prostate that I am going to discuss in the genital organ, but since I have it here, here is the vesical seminal or the seminal glands that is located laterally, and here these two structure, there is the end of the ductus deferens, which is becoming wider, and here is called the ampulla of the ductus deferens, which is this ductus deferens, as we said, it's crossed by the ureter, and the ureter is going under the ductus deferens. In female that we don't have ductus deferens, the ureter is crossing the uterine artery. So remember that the most laterally here is the vesical seminal, and the medial is the ampulla of the ductus deferens, and here is the prostate, and that's why those belongs to the genital system that I'm going to repeat it again. But by enlargement of the usually the medial lobe of the or middle lobe of the of the prostate. So this fossa, which is immediately behind the this vesical trigone, which is called retrotrigonal fossa, it can be become deep and cause the stagnation of the urine, and in this case cause the infection that I already mentioned. So after the urinary bladder, we have the urethra. Here what you are seeing is the urethra of the female. About the urethra of the male, we are going to discuss in the genital organ of the male, because the passage of the urine and the passage of the sperm it will be the same. So regarding the urethra of the female is very simple than and less complex than the urethra of the male. It's approximately the length is 3 till 4 centimeters, is starting from the internal urethral orifice, which is making the apex of the vesical trigone, and finishing at the level of the external urethral orifice, which is the place which is called the urethral papilla. It's the elevation which is approximately in front of the glans clitoris, approximately 2 centimeters in front of the glans clitoris. So the diameter of the urinary urethra is approximately 7 till 8 millimeter, and the direction from the urinary bladder caudally, it's the ventrocaudally, and it's going in front of the vagina and is open to the external genital organ of the female that we are going to discuss. So generally, the female urethra, we divide them according to their pathway to 3 parts. The first part, which is called intramural part, which is A, is this part of the urethra, which is as a matter of fact, is the pathway of the urethra through the wall of the urinary bladder. So that's why they call it intramural part. Then we have the pelvic part of the urinary bladder, which is starting after the passage of the urethra through the wall of the urinary bladder till the urogenital diaphragm, and it's the passage of the urethra through the lesser pelvis. Then after the last or the most caudal part of the urinary the urethra is the perineal section or the perineal part, which is coming under the urogenital diaphragm, and it's till to the external genital organ of the female that is open as an external urethral orifice. So this is the passage of the urethra, female urethra. As you see, the female urethra is passing the levator ani muscle, the place which is called the urogenital hiatus, and it's passing through this urogenital diaphragm, which is made by the deep transverse perineal muscle and also the external urethral muscles that they are making there, and they are forming the urogenital diaphragm, and the urethra is passing through this diaphragm. So this is one, and then regarding the structure of the urethra, the inner layer, of course, is the mucosal layer that is covered by the transitional epithelium in the upper part, but in the lower part, then is the epithelium is changing to the squamous epithelium. Then after the inner part, which is the mucosal part, then we have the submucosal part, and after the submucosal part we have the typical muscular layer, the inner longitudinal and the outer the circular fiber. That here the outer circular fiber, they are making the internal sphincter muscle of the urethra, which is we said that the sphincter muscle of the urinary bladder or sphincter vesicae, it's continue to this part of the urethra, which is called the internal sphincter of the urethra muscle. And of course, outside, it's a part of the urogenital diaphragm. We have the external sphincter of the urethra, which is this external sphincter of the urethra is the skeletal muscle, so it's under your control, and you can, by the contraction and relaxation of this muscle, you can control your urination. But the internal sphincter muscle of the urethra and the internal and the sphincter muscles of the vesicae or the vesical sphincter, they are the smooth muscle and is not voluntary. And finally, as we mentioned it, so this green part, it's the outer layer which is covering the urethra by the adventitia, which is the collagen connective tissue. The topographical relationship of the urethra, that in front of the urethra we have in the pelvic part. It means that in this part you have the plexus, the venous plexus, which is called pudendus venous plexus, and it's the place is related to the place under behind the pubic symphysis, which is called retropubic space, or they call it perivesical space or periurethral space, and it's covered by the venous plexus or pudendal venous plexus. In female, of course, down in the perineal region, it's the venous plexus of the bulbus vestibuli, or the vestibular venous plexus is located. Behind the urethra and posterior surface is related to the anterior wall of the vagina, and it's making an impression in the posterior wall of the urethra, which is called urethral crest, which is the impression of the anterior wall of the vagina to the posterior wall of the urethra. And finally, in the side of the urethra, in the pelvic part, again, you can find the plexus, the venous plexus, the pudendal venous plexus, and in the perineal part, again, like anterior segment, we have the vestibular venous plexus. So this is the structure that I wanted to discuss with you, and that's all inside the mucous membrane of the urethra. Of course, we have some lacuna urethralis or urethral lacuna, which is the small depression and the small fossa that the urethral glands they are opening. And of course, in this mucous layer, we have the urethral glands, which are the mucinous gland, and a small mucinous glands is called. The color of this mucous membrane is the reddish and purple layer, thanks to this highly vascularized and thanks to this venous plexus that we have it here in this region. And finally, this adventitia that is covering the urethra is called the parauretrium. Is the terminology, the adventitia, that it's cover the part of the urinary bladder is called paracystium. So the innervation, it's for the sphincter urethra, it's the pudendal nerve or nervus pudendus, which is a nerve that is controlling the contraction of this external sphincter urethral muscle. And the smooth muscle, as we mentioned, is innervated by the autonomic nervous system, which is not under your control. So this is the topographical relationship of the organs of the pelvic. Here, as you see, here is the urinary bladder. Very nice. You can see now the folds of the urinary bladder, or vesical folds, that is here is seen, except the area of the trigone that I already mentioned. Then here, behind the urinary bladder, here is the uterus, and the uterus is followed caudally here by the vagina, and here is the ostium of the vagina, and here is the rectum. This is the posterior wall. So it means that here is the pubic bone, and here it's the posterior part, which is the sacrum. For the female urethra, as we said, the length of the female urethra, it's 3 till 4 centimeter. It's not that much complicated because it's starting from the internal urethral orifice and finishing to the external urethral orifice in the external genital part of the female that we are going to discuss. And it's directed ventrocaudally, and this opening is approximately 2 centimeters behind the glans clitoris. Then the structure that we said that it's according to its pathway, the female urethra, we have 3 parts. The first part that is passing through the wall of the urinary bladder, so is this part, which is called intramural part. Then it's going toward the urogenital diaphragm, which is made by the deep transverse perineal muscle and the external sphincter muscle of the urethra. These two, they are making the urogenital diaphragm. So this part is called the the pelvic part of the urethra, and then after the urogenital diaphragm, it's continue to the external orifice of the urethra. It's the perineal part of the urethra, and already we said about the topographical relation of the urethra in the anterior side and in the posterior side, and also in the side that is surrounded by the venous plexus. Here, what I wanted to show you, and is very important, as we said that in female we have the urinary bladder. Behind the urinary bladder we have the uterus and the superior part of the vagina, and here is the rectum. Here between the rectum and uterus, here it's the peritoneum, is the deepest portion of the peritoneal cavity, an inferior portion, the most inferior portion of the peritoneal cavity, which is a Douglas pouch or excavatio rectouterina, or the rectouterine pouch, or Douglas pouch is called. It's very important because due to the bleeding of the peritoneal cavity, or accumulation of the, or due to the inflammation and accumulation of the exudation here in this area. So by the rectal examination, which is approximately at the level of the right transverse rectal fold or Chlorage fold, you can touch here in this area, and by touching of this area, if there is a severe pain for the patient, is the first examination that you do it, the rectal examination, to see if there are some inflammation or blood is accumulated here. Palpation examination, you can feel it, and of course you have the CT scan and the magnetic resonance and other examination. But this is the first examination that is giving a lot of information for the patient, that if there is accumulation of some fluid or some exudation here. Then, of course, in female we have another pouch between the urinary bladder and uterus, which is the vesicouterine pouch here, and also this is the inferior part of the peritoneal cavity. And above this area, you can find the small intestine, small intestine. Here, the posterior relationship of the urethra, the female urethra, with the vagina. With the anterior wall of the vagina, which is making the urethral crest, the impression, which is called urethral crest at the urethra. Also, it's seen here very well. For the male, that we don't have this uterus. So in this case, we don't have uterus and we don't have two pouch or excavation, but only we have one pouch, which is between the rectum and urinary bladder, which is called rectovesical pouch, that in next preparation I will show you. This is the rectovesical pouch that I already said. This is the deepest and most inferior part of the peritoneal cavity in male, because here is not uterus, so anteriorly we have the urinary bladder and posteriorly we have the rectum, and between the rectum and the urinary bladder we have this pouch which is called rectovesical pouch, and in male this rectovesical pouch is the deepest part of the peritoneal cavity. And again, by the rectal examination from the anus, approximately 6 centimeters above, there is a right transverse rectal fold or Chlorage fold that you can. It's approximately the level of this excavation or pouch is. So here once more, it's the prostate. Here is the urethra, and here is the ureter that is open to the urinary bladder. So in this preparation, you can see the content of the abdominal cavity and the content of the pelvic cavity and pelvis. So for your orientation, to understand what are the structure here. Here is the diaphragm. So you can see the diaphragm, which is separating the thoracic cavity in this area from the abdominal cavity. From this area under the diaphragm on the right side, you can see the liver here. Here is the visceral surface of the liver. Here you can see the gallbladder. Here is the right lobe of the liver, and here is the left lobe of the liver. Here is the quadrate lobe. Here is the gallbladder, and here is the portal vein at the region of the porta hepatis that we already mentioned. The structure of this porta hepatis: posteriorly the portal vein, anteriorly and right side is the common bile duct, and anterior left side is the proper hepatic artery. Then here the structure, the passing through the diaphragm through the esophageal hiatus together with the vagus nerves. It's the esophagus, and here is entered to the stomach. That here is the fundus of the stomach, and here is the pyloric part of the stomach, and then the small intestine here is removed to see, and the peritoneum also it's removed to see the retroperitoneal structures. The retroperitoneal structure, you can see the inferior vena cava here, and the abdominal aorta, which is located here, and here it's the renal vein, and here is the renal artery, and the renal artery, another one, the right one, and the left side, the renal artery. So here, of course, the kidney, the position of the kidney, as we mentioned it, it's the superiorly, it's covered by the diaphragm, and the posteriorly is sitting on three muscles from the medial side, the psoas major, quadratus lumborum, and transversalis abdominis, or transversus abdominis muscle posteriorly, and also it has the posterior relationship between the 12th and rib number 11, and also the three nerves, the subcostal nerves, and the iliohypogastric and ilioinguinal nerves. So here you can see the pathway of the ureter here. This is the hilus of the kidney, and here is the ureter. So ureter is passing retroperitoneally in the abdominal cavity. It's passing over the musculus psoas major here. As we said it, during to its pathway, it's crossing over the genitofemoral nerve that is located over the surface, anterior surface of the psoas major. Then here in this place, that in the left side is crossing the common iliac artery, and in the right side here is crossing the external iliac artery generally and usually. So here is the place that it's called terminal line, and this is the most anterior position of the ureter toward the anterior abdominal wall, that is called ureteric point, that in the bispinal line it can be determined, the bispinal line, the anterior superior iliac spine, one side to the other side, the border between the right third and middle third here, so it's the ureteric point, and also, if you remember, it's Lance point as well. So then here at the level of the terminal line, so it's entered to the lesser pelvic, and then it's going to the from superiorly, it's and posteriorly is going to the urinary bladder. So here is the urinary bladder. Behind the urinary bladder, this is male, so we don't have uterus, and here is the rectum, and this is the urinary bladder, and between them, between the urinary bladder and rectum, it's this pouch that already said that this is the rectovesical pouch in male, that it's the deepest part of the peritoneal cavity in male. This is another preparation that you can see the diaphragm again here. The diaphragm, it's the typical border between the thoracic cavity with the abdominal cavity. So here at the thoracic cavity, you can see the right lung and the left lung. Here is the pericardium, that is the heart is removed from the body, and here is the starting of the ascending aorta, and here is the arch of aorta with the large vessels that they are arising from the arch of aorta. And back to the abdomen, so under the diaphragm, so you can see the liver, which is covered by the coronary artery that is continue with the coronary ligament that in the side it's continue with the triangular ligament. Here it's the ligamentum tres or a round ligament of the liver that you can see here. Here is the visceral surface of the liver. Here is the diaphragmatic surface of the liver. The visceral surface, you can see here the porta hepatis, the area of the porta hepatis. This is portal vein. A little bit is destroyed, and here is the common bile duct, and here it's the proper hepatic artery. So posteriorly portal vein, anteriorly right side common bile duct, and anterior left side is portal is proper hepatic artery. So the diaphragm is perforated by the esophagus, and here is the fundus of the stomach. The esophagus is open to the stomach at the cardiac ostium, and then here is the pyloric part, and again the small intestines, there are duodenum, jejunum, and ileum, they are removed. See the retroperitoneal organs, which is here the right kidney, and here is the left kidney. Here is the vena cava inferior, and here is the abdominal aorta. Once more, here is the celiac trunk. This is the place of the aortic hiatus. So this is the aortic hiatus, and here is the first branch, the celiac trunk. This is the superior mesenteric artery, which is going toward the right side, and here there are the jejunal and the ileal and the ileal branches for the supplying of the small intestine and so on that I already mentioned. And here is the inferior mesenteric artery, which is going toward the left side, and here is the bifurcation of the aorta at the level of the L4, which is divided to the two common iliac artery, and further is continue with the external iliac and internal iliac artery. And back here is the renal vein, and here is the catechorenal artery here from the aorta, and here in this right side also you can see the renal artery here, which is coming from the renal the aorta here. So what I wanted to show you here, it's again the passage of the ureter. The ureter is passing also in retroperitoneally through the abdominal cavity. Here is the crossed over the external iliac artery, and it entering to the lesser pelvis, and here it's the place that is called terminal line, and here is a little bit destroyed the psoas major muscle that is passing over the psoas major, and in this case over the genitofemoral nerve, but under the testicular or ovarian vessels that are already mentioned. So here in the lesser pelvis, you can see the structure that this is sigmoid colon, that it continues as a rectum, and here we have in female. So this is the female cadaver. So here then we have the uterus. So here is a view from above. Here is the fundus of the uterus, and those are the fallopian tube or uterine tube that we are going to discuss in genital system, and in front of the uterus then you have the urinary bladder. So here is the urinary bladder. So in this case, three structure: the rectum, the most posteriorly, in the middle the uterus, and in anterior side we have the urinary bladder, and between them there are two pouch. One pouch anteriorly between the uterus and the urinary bladder is called vesicouterine pouch here, and the other, which is the deepest pouch in female and the most inferior part of the peritoneal cavity, is the Douglas pouch or the rectouterine pouch or excavation that is here, and you can see it. You can see it here in this area. So this is a difference between the female and male, and of course in female the ureter is crossing under the uterine artery instead of the ductus deferens that it was in the male. Dear students, that's all about the urinary system. I hope this video it will be useful for your studies. I would like to thank my colleague Dr. Petrashek for his help, and I wish you have a nice day, study hard and stay safe. Thank you for your attention.